the pregnancy already having a sleep issue, then we can see changes in that baby within the first few weeks of development. On ultrasound, you can see changes in the vasculature. You can see that when the mom stops breathing, the baby stops breathing.
That's scary.
Yes, so even the wiring of the brain of that child, because it will start to panic and be responsive to the fact it's not getting oxygen from the mom. So right in utero, we have a chance to really impact that child's life. Otherwise, we're scrambling to catch up when that baby's born. Because they have difficulties with feeding, we want to jump right in and solve that. So we'll supplement and maybe turn to bottle feeding, or we'll put a tube down so that they don't have to work as hard on the mom's breast, but they'll still get the nutrition. And we focus on the nutrition because we want to make sure the baby's gaining weight and all of those issues. But at the end of the day, what it does is further weaken those facial muscles. They need to work those muscles to build the jaw for the face to grow forward. So it's like this cascade of events that takes place that started in utero. I brought a couple of things to show today, so I'm just going to show you this. So for example, you know, the suck swallow, how important that is to a baby. And there's this product where it can help to, rather than a soother, which then perpetuates this, like a bottle would, like a thumb suck would.
Pacifier.
A pacifier, how you start to get the arch
Up.
being vaulted and narrow, and you start to get more crowding of that airway. We can guide growth with devices similar to this, where the baby would chew into this, and as they grow, you would just be replacing it with a larger and a larger one.
Okay.
To help guide that growth and keep that arch expanded, right? But you're going to prevent a lot of issues down the road if you guide growth in that child. Okay.
Yeah.
So you look at the development of the embryo and how it kind of unfurls, right? That
Yes.
baby unfurls. When there's tethers, that fascia is not unfurling properly. That child's going to have issues. The adult will have issues, back pain, neck pain, whatever, related to the fact that this did not unfurl properly.
Like release in the proper way,
But
right?
anyways, a lot of what parents are concerned about is the child's tonsils are enlarged, and it's occluding the airway. There was a time where everybody had their tonsils and adenoids removed. Now it becomes a challenge to get your tonsils and adenoids, and it's gone out of favor, if you will. So there's two sides to that, because one, ideally, if that child is
there ever a danger for, let's say, all the hygiene moms out there, like, well, I know my kid needs this appliance that maybe isn't really indicated, maybe they're being a little bit too aggressive. Is there a danger for someone using something like this one? There's no
in the dental world, I believe, my personal belief, is that they're related to airway. Because you look at even the cavities in the front teeth. Well, they want to say it's because the mom's breastfeeding, but moms have been breastfeeding their babies for eons. Why are we seeing issues with this? I think it relates more to the fact that people are mouth breathing. Helping orthodontists to understand you never ever pull back. If you're a class 3, it's not that your jaw is too far forward. It's that your maxilla
is too far back.
Yeah. And so why is it back there? Because you're not using your nose.
Your sinuses aren't expanding, all those things.
The bone will grow when you're using that nasal airway the way you were meant to. It will grow. So, you know, for adults, one of the issues with the appliances is going to be which one, right? So Michelle clearly dislikes certain ones, but you know, you're going to look at obviously how much room is in the mouth, the appliance, how much stuff do we have to put in there? What is it made out of? Does your patient have a nickel allergy? Can you use the ones that have metal, or does it have to be all plastic or all nylon? Do you how large is their tongue? Do they have a heavy, thick neck? Are you able to titrate? Do you need to leave room in case the person is a grinder?
And one of the things that we see on a regular basis is a mouthful of wear. And so we say you're a bruxer, and when we're doing our assessments and checking muscles, we know that. So what do? We make a big piece of acrylic and we stick it into a space that's already overloaded with stuff. There's no room for their tongue and their cheeks, and their airway is suffering. So